What's going on, y'all? So let's go ahead and hit that live. So we are getting ready to start the surgical sections. Okay, let me make sure this thing is up. We're getting ready to start our surgical sections. Everybody should have their book. Okay, if you don't have the book, go ahead and hit those links on the bottom. Okay, those are ebooks down there, which you can use until we get to the end of musculoskeletal system. Okay, this is for you too, Twitch. When we get to the end of musculoskeletal system, that's when y'all probably gonna need your books, because the ebooks are good, but they only have about 35% of them. Okay, so let's just do like a recap. Y'all know how I do when we get ready to start the class. So this is a free class. Make sure you guys look at the playlist. The playlist has all the classes in there. Okay. You guys know that I have two classes now. The other one is a finance class. I encourage everybody to get in on those classes. So I'll be talking about different things in those classes. Okay, including life insurance, mortgage. We have a partnership with Rocket Mortgage, so don't sleep on that channel. Whatever I'm talking about on that channel, get in on it. You guys got questions, ask. Okay, but this portion of this channel, I'm not going to make a new channel for that. We're just going to combine that because they're both involving actually insurance and finances. So that's the reason why I combined those two. Those two chats. Okay, so this class is your coding class. If there's somebody new who wants to get in on the class, you can start whenever you want to. Okay, the Sapphire Academy is extra resources for you. Okay, it's extra resources for you. It will help you pass your CPC. So let your friends know this is a free class. Okay, I start the billing from the beginning to the end, right? When you get closer to the more advanced course, okay, that's your CPC guide. That's when you're getting ready for your exam, for your license certification. So somebody asked me about the insurance certification. Yeah, that's a license certification too. I'll have a whole different training program for you for that. Okay, it's a whole different training program. Go ahead and go on primerica.com and just kind of look at what's on there. I'm gonna put my website up in a few minutes too. Okay, so make sure you sapphirecoding.com. Okay, the sapphirecoding.com is the Sapphire Academy. Okay, so that is for you guys to go on for more resources. That's for those of you who want to be certified in the coding. Now the insurance classes, that's different. Okay, that's your different coding. I have a whole new class for you guys. That's a physical class. You have to be state certified. Okay, state license for that insurance. Okay, that's a whole different ball game. You guys DM me if you want to do that. So I'm based in Atlanta, Georgia. So if anybody does need life insurance, the life insurance that I do has to be in Atlanta, Georgia. I can recruit any of you from, anywhere. Okay, anywhere in the States. We can do Canada, we can do Hawaii. So if you guys want to do something new, you guys want to try your own business, that's what it's about. We use the products, but basically you have your own business, okay? But you do need to pass that license, okay? Is it harder than the coding, Miss Lambert? Absolutely not. It's not at all. It just takes perseverance, and it's going to take a lot of reading. You guys have to get through modules, okay? That's going to be the next chat. I'm going to try to do that chat after this one because I know a lot of you want to know about my new classes and the insurance, okay? I chose to do that because I have a lot of people who have taken my class that are in life insurance. Okay, it's not just life insurance. It's a lot more than that. But I'll try to do it after this class. If I don't, y'all gonna see the thumbnail go up, and I'll try to do it tomorrow. Y'all know I'm not prone to doing class on Sunday, but we'll try to fit it in. Okay. So again, your links is below. This is your surgical class. We have started the coding. If you have missed the beginning classes, I want you to archive the classes from the medical billing first, medical terminology, okay, and then you're going to jump into the coding. It doesn't matter when I start the class, you are going to catch up with us. The E&M and ICD-10 and CPT, there might be 25 classes or something like that. But get through those classes. It should not prevent you from starting with us right now. Okay, so general surgery is starting with the series section. Okay, and it's not that big of a deal. If you want to start now, go ahead and start now. It's okay. If you guys have any questions, go ahead and put the questions in there, and I'll get at you. Okay. Kindle. The books come from Kindle. They are ebooks. Okay. So, don't fret to go on Kindle. Okay. You're not going to buy anything. You're just going to download the books. Somebody asked me about Evolve the other day. If you go to Evolve Elsevier, okay, if you get to the point where you see what's your school's name, this is for YouTube. Okay. I'm putting it right here. Your school is Sapphire Physiciancoding, LLC. Okay, yeah, I have a real school. This is a real school. They ask you, where is the school? My base is in CT. Okay, the town is Waterbury. Okay, so if they ask you that and you get stuck, and they say, I don't see what reason, they would be asking you. But if you want to see other stuff in there and they ask you what your school is, you tell them Sapphire Physiciancoding, LLC, Waterbury, Connecticut. Okay. And when you go on there, all the books are there. You can get your books there as well. I can't share my books because all of my books are teachers' books. But you can go there and get your books. Like I said, sometimes on Amazon, 3 or 4 in the morning, they have like a crash deal at Amazon sometimes. You can also go on my website and get the books from there as well. Okay, so you can go on Sapphire Coding and order the books from there as well. I'll send you the book. Okay. Okay, what else? Well, I'm trying to answer all the questions I got in the email. How long does it take you to do this class? You're the one who's going to decipher that. I have schedules for you. I have a fast track schedule for actually 6 weeks and 9 weeks. There's a 20-week schedule and there's also a 40-week schedule. This is in the Sapphire Academy. So YouTube, you don't have a necessary schedule, but I try to put you in the right place. I did give you guys a schedule on one of your other chats. Check the medical billing chats. There's a schedule in there for YouTube. Okay. Your official schedule will be in the Sapphire Academy, and that's going to keep you on track. I don't have one around here. If you go find that chat, you will see it on there. Okay. I thought I laid one over here for you guys. But if you go to that chat, again, you can go ahead and get it from there. And it pretty much is going to keep you on track, okay? I don't want you to get too far behind. So if you're starting today, let's say you're a new student, you're starting today. So you're starting with us in general coding, surgery. We're getting ready to get into the heart of the coding. So if you missed the how-to, that's what happened. You missed the how-to. So now you're going to have to catch up. So the book that you're going to use for that is your step-by-step book to catch up with the coding classes, okay? Your medical terminology, I don't know what's in my throat. Your medical terminology, you're going to use that language of medicine book, okay? There's a link there also for the language of medicine. It should be right below this one that we're in. So when you start my class, I don't leave you in the dark where you don't have any books. You have access to all the books. And that should give you a good 3 or 4 months until you actually get the books that you need. Now, you don't need to get the books all at one time. If we're in medical billing, then you have medical billing. If we're in language of medicine, you're in language of medicine. So we're in the colon. So just like now, we're not up to the CPC guide yet. Okay, the CPC training guide is the more advanced class. As we get down the line, you will have those cases to do. The Sapphire coding, hi, how are you? The Sapphire coding classes, you have tests in there. You have essays in there. I need to have the essays from Sapphire Academy because that's how I know that you guys are on track. You have folders in the Sapphire Academy. I need to know where you're at. This is a live video. You can talk to me. This is a live video. So, if you have any issues, with you didn't pass your test, people who come in and know my class, you took a medical billing and coding course, you didn't finish it, or, they didn't talk about the CPC or whatever. Okay, then you need to come on over to Miss Lambert's class, okay? Don't worry about any of that. Don't worry about going back to school. You are here. This is your classes here. We're going to help you pass your course. The purpose of this class is to help you pass your CPC and to teach you the medical billing and coding. You don't need to have a student loan for that. So your medical billing and coding, those ebooks are already up there for you. So you guys know when I usually do this class, I do put the books up there. Let me see if I can. They'll be low. I mean, you guys can go ahead and get them, but because it's visual right on the side, and you guys can literally just click on it while you're already in class, helps you a little bit better than kind of looking for them down below and a lot of the written material that I have down there. So and you guys can feel free, get your books. You want hard copy, that's fine. What we do here is give you the ebook because you don't have to carry it anywhere. If you're at work and you want to pull out a book, you can pull it out on your phone. I usually kind of carry around my iPad, if I want to see stuff. I wish they made the iPhones bigger, a little bigger, at least like that. I know the Androids are pretty big, but I'm not an Androider, so I wouldn't be able to use it. But I'm going to put these links up here. So this is the ISBN, and again, you can follow along. These links will take you straight to the book. Okay, so I mean the Kindle is in Amazon. Okay, so that's your ICD-10. It's like a sneak peek in Amazon. Okay, that's your ICD-10. Okay, I'm going to give you CPT. This is what you need for the course that we are in right now. Okay, what we are in right now. Okay, and for the classes that you missed. So you need your CPT. You need your ICD-10. You need your HCPCS for the anesthesia class. So I'm going to put that there as well. Because you have HCPCS to look up, I want you to look up those modifiers that we went over the other day. So you guys remember when we did that, right? That class just ended yesterday. If y'all need more of that class, let me know, okay? Let me know. You're going to have to join the Sapphire Academy so you can get in there and get more of that class, okay? We can't do like a full class, on YouTube, but I try to make sure I put you guys in the right place and make sure that I'm available for questions. So this is a medical billing book. Okay, that's medical billing. Okay, what I'm showing you now are the books that we use for my class. Okay, this is the medical billing workbook. Okay, and you should be good with these books until you get your own. Okay, this is the workbook. That's the workbook. All you have to do, make sure you got Amazon and Kindle. Okay, you don't have to buy anything. Okay, this is your step-by-step book. Okay, I did not write anything on this book, but this is the step-by-step book that I'm getting ready to put up there. Okay, so what you guys see me posting right now, I'm going to write this, are the books that I use for my class. Okay, you can do the same thing. You don't need to enroll in a school for coding. You don't need to enroll in a school for medical billing or medical terminology. The medical terminology class, we had a blast in that class. So some of you who are going to archive this that were in my medical terminology class, it was amazing. Okay, and those of you who are starting my class, when you archive that, just make sure you take notes. Okay, we went through the full language of medicine book. Okay, the entire book. Y'all know I don't play. Okay, because everything in that book you will need. You will need. When you take your tests, we don't know what's on the exam. Okay, we only know that, they're going to put everything in there that you see in these books. They're all complicit, right? The step-by-step book is mimicked like the CPT book. Okay, I won't say we don't know what's on there, because you could go on the website and go to testing, go to CPC, and it'll tell you what's going to be on the test. We just don't know what the questions are directly. Of course we don't. So, again, I want you to, just feel comfortable about taking your CPC. Trust me, the state license for insurance is, I'm going to tell you right now, I don't think it's anywhere near what you guys are going to have to do for, let me turn this down. Is it down? Okay. I don't think it's anywhere near what you guys are going to have to do for the coding. But it's a lot of reading. There's no deciphering the codes. It's a lot of reading. Okay, it's a lot of reading. Okay, I just pulled that up because I want y'all to get back to that. So, don't be scared. Don't be scared. Okay, every exam is creepy, but the more you practice, the better you will be. That's why I don't want you to put the answers in the back of your book. The answer grid that I gave you guys, y'all know how I am. I got the old school answer grid. It's in your medical billing chat. It's in your MT chat. I put it in there because I want you to print that out. So you should be able to print off of YouTube. I don't think it's a problem. Nobody told me they had a problem printing from YouTube, but that's not a big deal. I mean, if you want it, DM me and I'll Google it to you. But I'm going to post it here again. It's just a sheet you put your answers in. Okay. The Sapphire Academy has a specific file for stuff like that, and especially to put your answers. So for each one of your courses, I give you an answer sheet that I created myself to make sure that you keep up with what you're doing. The medical terminology book, this is the one, y'all probably can't see it, but this is the one that I gave you. No, it's cutting the whole thing off. Okay. When I do my chat after this one, I'll show y'all. It's the medical terminology questions are in there that y'all asked me for. So that's the book the medical terminology book. No, I was not putting the answers in there, but I did put them in there so that YouTube will have access to answers. In case you guys don't want to join the Sapphire Academy, you can just go to Amazon and buy my book, or you can go to my website and buy my book. Okay, so that's how we make things easy for you. So let's kind of get started with the class. So if you guys have any questions, just DM me. If you've been to another school or XYZ, just DM me. So we're in the step-by-step book. Okay, you guys got your step-by-step book? We're on the surgery section. Okay, this is chapter 13. Is it 13? Yes, surgery guidelines in general surgery. Now, you're also going to use your workbook with this as well. Use your workbook. I want you to use your workbook because you don't have you don't have cases from me. You don't have anything for me to work with. That's in the Sapphire Academy. But YouTube, you have the workbook. The workbook will give you exercises to do on every chapter that we do. Okay? Let me just bring this down. You guys probably can't see this, but this is not generally for you to see because you should have your book. Okay? So surgery guidelines, general surgery. Okay? These are the topics that we are going to discuss. Introduction to the surgery section. That's what you guys are going to do. Remember, this is the theory. This is theory that we're doing. You will be doing the practice when you go home. When we finish. Okay? So theory, practice. Theory, reading, letting you know what we're doing in the class, reviewing the subjects, learning the objects. What are we supposed to learn in this classroom? Practice, exercise, essays, summary, right? Good. So, notes and guidelines, unlisted procedures, special reports, separate procedures, surgical packages as in pregnancies, deliveries, general subsection, and chapter review. Okay, that's what we're going to do today. Okay, well, y'all know we're not going to get through all of that today, but that's what we're starting with, okay? And some of you who just started my class, if you go ahead and get through this, save time for you to do the classes that we did prior to this. So you can go ahead and review those tests. The next class is Monday. The next coding class is Monday. So give yourself the weekend, and you can try and catch up with us, okay? So your learning objective is understand the surgery section format, okay? Locate notes and guidelines, okay? Interpret elements, unlisted procedures. I'm just kind of repeating what we just said, okay? So that's where we're at. And in this section, how many is it? 1, 2, 3. I think it's 1, 2, 3, 4, 5, 6, 7. There's 7 sections. So this is a pretty big section. So I'm pretty sure this is going to be about a good 4-part class. Okay, this is going to be a 4-part class. Okay, so if you guys have your book, go ahead and read this section right here. Introduction to the surgery section. The surgery section is the largest in the CPT manual. Okay, the surgery section is the largest in the CPT manual. What do I mean by that? What is your surgery section? Series 10,000, series 20,000, series 40,000, series 30,000. I'm going backwards. Okay, so that's what you're going to be learning if you have your book. Okay, I'm scrolling down in case y'all didn't get to click. I'm scrolling down. Okay, that's it. You see the one that says the CPT Kindle? I'm just giving y'all a minute to get it. Let me get my, you got it? Okay, let me go get mine now. La, 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 la. Let me get mine. Okay, so I'm in the CPT book. All you gotta do is just open it up, and you can get yourself down to the surgical sections. Okay, when they say surgical sections, those are the systems of the bodies. That's what we're gonna be doing, right? Cardiology and all of that, right? That's the surgical sections. The book that you have goes up to musculoskeletal system, okay? That surgical section is the 20,000 series. That's the surgical section, okay? The 10,000 section, the surgical series, right? Y'all know what I'm trying to say. So, when you go home, at least you have a book to work with, because by the time I get to musculoskeletal system, you'll be good. So when we say surgeries, we're talking about the surgical sections, okay? So that's where we're at right now. So y'all see how I just opened up that book? That's how your book should be open. So even if you don't have the book, go ahead and use the Kindle for the book, okay? All right, so the surgery section is the largest in the CPT manual, okay? That's minus E&M, minus anesthesia that we just did, right? Good. The codes range from 10,000 to 69,000. Okay, this is what we call series. 10,000 series, 20,000 series. Okay, y'all can flip to that and find the series at the top. If you've got a hard copy, it should say series. Okay, surgery is divided into subsections. Okay. You might get a test, you might get a question to say, what is surgery divided into? Yes, subsections. Okay. So remember, we're reading from the step-by-step. So the step-by-step is a coding teaching manual. When you have your test, that's not going to be in there. You're going to have to know that. Okay? Because you're not going to have time to read the front of the book. Because, let me get back in there. In the front of the book, there are guidelines there. There are guidelines there. You're not going to have to, at the beginning of each section, there's guidelines. So at the beginning I'm just scrolling through. I can't take too long to look for that surgical section. But when you are home and you're getting to that surgical section, there are guidelines up there anyway. Okay, there's guidelines up there anyway. But I don't want you to spend time with that now. We're getting ready to just breeze through a couple of chapters, and that's it. So in your CPT book, you must know what the subsections are for your test. Okay, you have to know what subsections are for your test. When we finish, I want y'all to get your 2 hours, because that's your 2 hours after me. That's your 2 hours. You guys have your syllabus. That's YouTube, please. Okay, YouTube, y'all have a syllabus. Okay, I gave y'all a syllabus just like Sapphire Academy. If y'all don't have that syllabus, let me know. The syllabus lets you know what you are doing in my classroom. This is for the YouTube class too. The coding class. How many hours of the coding class? How long should it take you to finish the coding class? What are you learning in the coding class? That's the syllabus. Okay. Look at one of my chats and see if it says syllabus in there. Because I remember putting the syllabus up there for you guys too. But anyway, okay, let's move on, because y'all know how I get thrown off. I have to remember that I'm not in a regular class and you guys don't have 8 hours. Okay, so remember the subsections. Okay, most surgery subsections are defined according to medical specialty or body system, integumentary or respiratory. Take a moment to review the surgery subsections. So everybody just kind of flip through. If you have a hard copy book, just kind of flip through the book. Okay, subsections of CPT manual, so you have an understanding of the content of this important section. Now, those of you who just started in my class, as soon as we start the coding class, as y'all missed this class, I'm just kind of backtracking. I want y'all to look at every page in the CPT book. I don't know why I'm looking lopsided. I can't fix it. Every single page in the CPT book. Why, Miss Lambert? Because a lot of the codes look the same. Whether you know the codes right now or not, you're not going to remember any codes. The gist of coding is to figure out how to decipher the words and put them into numbers. We're taking the words and transferring them into numbers. The book is going to lead you to the right code. But there are times when you see those two codes and they look alike. So that's the purpose of me having you go through the book. I want you to go through the book and highlight. Use yellow or whatever color you want to use. Highlight the ones that look the same. If you have 67311 and 67310 and they sound the same, but as soon as you get to the end of that code, it's different. It'll throw you right off. So that's why I want you to make sure you look at your CPT book thoroughly, especially in the surgery section. Okay? The medicine section is also a different section. It is not considered the surgical section. Okay? But I'll just do that in there. Okay, so within the surgery section, some of the more complex subsections are the integumentary system and the musculoskeletal system, respiratory system, cardiovascular, digestive, and female genital subsections. We're going to go over all of that. Right now, they are showing you what subsections are. What do we do with the subsections? These is where you're going to code. Okay, the surgery section is the full sections that you're going to code from. On your CPC exam, they're going to have 2 or 3 cases in respiratory, 2 or 3 cases in cardiology, 2 or 3 cases in digestive system, and then you're going to have the open and closed questions. Do the open and closed questions first, and then you get to the surgery cases, okay? That's the surgical sections, okay? So again, do not forget, your surgical sections are here. Okay, these are actually the easy ones. These is, let me see, respiratory, cardiology. Yeah, these are pretty easy. Your fickle is going to be your fickle is going to be X-ray. Let me see, radiology, lab, and path. Yeah, those are going to be the fickle. We ain't get to those yet, so don't worry about it. Okay, before we get into the details of the subsections, let's look at the general information. Now, you are going to read that. I'm not going to read this to you. You have your book. I want you right here where it says notes and guidelines. That's where you're going to start from. That's where you're going to start from. Guidelines are found at the beginning of each of the CPT sections. So you guys remember I said that. Each section has guidelines in the front. Don't sleep on the guidelines. Just like with the ICD-10, the guidelines in the front of the book, you must read them. In the ICD-10, you're going to have at least 4 questions on the guidelines, okay? So that's why I want you to make sure you have the guidelines down pat. I'm going to scroll down so you guys can see the ICD-10 link. That link will have the guidelines in there. Okay, the link will have the guidelines in there. Okay, you can also get the guidelines from CMS 2026 from 2025, 2026 from cms.gov. Okay, so just make sure that you're precarious about that. This books that I'm giving you is a 2025. Tomorrow, when you guys have your class Monday, I'm gonna load the 2026 in there. But 2025 is fine for right now. It's okay. Okay, as long as you're not taking your test with an old book past 2024, I'm not gonna worry about you putting up the wrong codes. Codes have or may changed. As you can see, there was no COVID code, and we had to make exceptions and try to figure out what we were going to use because we didn't have a COVID diagnosis. So just be precarious of that. Read the guidelines. So again, your guidelines are found at the beginning of each subsection. So you will see respiratory. The beginning of that, there's guidelines. And when we say guidelines, the guidelines is literally telling you how you should be coding, what you should be looking for. Don't use this code with that. If you see this, don't use this code with that. So yeah, they still give you direction. That's why it's a must. You have to read it, because when you take your exam, when you're taking your exam, you don't have time for that. Once the proctor looks at your book and that test starts, everything should be in front of you. And some of you who are already getting ready to take your test, don't forget your calculator. Bring several pencils. Okay, don't forget your calculator. Don't forget your watch. Okay. Services, a reference explaining how to assign E&M codes. Okay, they're telling you actually what's in the guidelines and what you're going to look for. Same thing I just said a second ago. CPT surgical package definition defines what is included in the surgical procedure. So when they say surgical procedure, surgical package, if somebody is having a cabbage is, so heart surgery, they have it cranked, you crank open your chest, all of that goes in there. It's like a thing. We break it, your chest has to be broken, and that's how they do it. You have to make sure that you know packages, but I'm not making it sound, am I making it sound harder? I'm trying not to make it sound harder, but when you have surgical packages, I want y'all to make sure there's no down coding, there's no up coding. Okay, that's a little further down the line. But right now, this is a beginner class. So make sure that you read the guidelines, okay? Follow-up care for diagnostic procedures defines follow-up care for diagnostic services. Follow-up care for therapeutic surgical procedures. They're just pretty much telling you what's in the guidelines at the beginning of the book. Okay, that's all they're telling you. This is primarily a quick check of a question that they're asking you. Okay, this is for you to do tonight once this class is finished. I don't want you to move on to unlisted procedures, but tonight I want you to stay right here. Okay, and if you guys can see this portion, when you see these little arrows, they're telling you what's going on. It says new or revised text. If you see something like this, that's what this means. You see this little it's like a little square right there. If you look at the bottom of your book, if you have a hard copy book, you'll see something like that. It's just like this. Like I said, the CPT book and the step-by book is complicit. Everything is the same. If you go through the CPT book, they're going to show you the same type of direction. The step-by-step book just shows you more detail because this is what we use. This is the same book we use in the college. How you're going to code, okay? Try not to overwhelm yourself, okay? So, I want you guys to read that, reporting more than one procedure or service. When a physician performs more than one procedure or service on the same date, during the same session or during a post-operative period. The patient went home and he had to come back, and the doctor had to open him up again. Okay, that's what they mean when they say that. Okay, I want y'all to do like what's the guy's name on the Twitter thing? Kai. I want you to do like Kai. As you're reading and you don't understand that word, look it up. I've told y'all that even before Kai started doing that. But when you read medical terminology or you're in your CPT book, it's all about medical terminology. That's why you have to do that medical terminology class first. If you come across something that you're not going to decipher, you're going to, because some of you have not done the medical terminology. Just look it up. Just look it up. That's why I want you to go ahead and archive those classes, and then you'll get with us with these. You'll be kind of up to us, okay? Because this is our open enrollment class. You can start today. You can start tomorrow. That's the reason why I have the classes archived, okay? So, don't get scared, when you're starting something new. You just have to steadfast, because in here, if you want to start your own business with coding, you want to start your own business with billing, it takes perseverance and time. Okay, it takes perseverance and time. In the Sapphire Academy, I have pre-tests in there. I have many, many tests for you to take to get you used to doing those codes. Okay, if some of you want to, if you want to move on to be more advanced, you go get the CPC guide. And you can move on more advanced with that as well. Because a lot of times I kind of reference that book. Okay? Because everything is complicit. If you look at the CPC guide, my book should be over here. I don't know where it is. If you look at the CPC guide, it's made the same way the step-by-step book is. If you look at the CPC guide, it's made the same way the CPT book is. Okay? So, just don't go too fast, take your time. I'm sliding through because I've got about 15 minutes. But here, I want you to do all of this. There was a little exercise in here I want you to do. Here, a listing of subsections that have instructional notes is not included in the surgical section guidelines, okay? Don't answer it, because you're going to do that part of your homework, okay? Because we didn't read this thorough. You're supposed to read that. Okay, so again, the surgical section guidelines is what we are doing. Okay, you're generally reading about this subsection. Okay, let's say I'm doing this class right now, and let's say I finish off page 370. Don't move on, okay, unless you've done the full chapter and then the workbook. Okay, and then you need a recap. Okay, so here is just going to show you what we are talking about, exactly what we are talking about, okay? So, musculoskeletal system, subsection. This is the subsection, okay? And then they're explaining to you what's also in here, okay? Cast and strapping procedures appear at the end of this section. So, if you have a patient that has a broken leg, don't go looking for it right here in the beginning. Okay, it's going to be at the end. And then some that need a cast, the cast is included. Okay, I know that's moving too far, but we're going to get to that. We're going to get to that, okay? We're going to get to that. The services listed below include the application and removal of the first cast or traction device only. Traction device, he might have what do you call them, little pins he might have in his back and bone. He might have the pin holding his knee from his calf together, okay? And here, they're just telling you notes. There's going to be notes in each one anyway. There's going to be notes in each section. The gist of this is so you can see where the subsection is. Okay, the subsection is what, guys? The musculoskeletal system. If you have something like that on your test, what's a subsection, and they got it on in your test, in your ABC, you know where the subsections are. Okay, I want y'all to count the subsections in your book. Okay, they gave you some of them right here. Right here. Okay. So I'm gonna have to close that window down. But subheading. Okay, this is your subheading. Spine. Okay, that is your subheading. Vertebral column, cervical, thorax, and lumbar spine. That's your subheading. So subsection, subheading. So we're in the section of musculoskeletal system, right? So where is the patient going to be operated on? And what area is the doctor operating on? In that subheading right here. Spine, vertebral column. Okay? These are notes. And a lot of these notes are going to tell you how you need to use this code. Okay? The category. Grafts or implants. Notes always below. Okay, always below. Make sure you read the notes. This is what y'all doing for homework. Y'all are reading the notes. I don't know how an hour was. I late? I probably was late because I don't know how it was 6:50 already. Okay, codes for obtaining autogenous. I can't say it. Bone, cartilage. See, I need to be looking that up because I can't call it autogenous. Okay. Separate skin facial incisions should be reported separately unless the code descriptor references the harvesting of the graft or implants. Now, you see what I was saying when I was telling you it's going to tell you how to code it. It's going to tell you how to code it. That's why I want y'all to go through the full CPT book. Let me push this back down. I want y'all to go through the full CPT book so you can see these different types of codes. Because if you don't get used to the book, you're not going to be able to go the boom through your CPC exam. The gist of the exam is to make sure that you have mastery level. We don't start at mastery level here. Y'all know I don't do the book thing. I don't do that. We start from the beginning. And then we work our way up to mastery level. So this class will work you up to that mastery level. I don't want you to feel like you're pushed or you're rushed. They know how I am in Sapphire Academy. You got a schedule for 20 weeks, stick to your schedule. If you fall behind or you forget something, your schedule will take you to where you're supposed to be. Okay? So same thing for YouTube. If you guys find that schedule, just work it out. You can also make your own schedule on YouTube. Okay, so let me get back to where we were because I have to close that down in a minute. Okay, so the category is graft. You can't tell here, but you will see in your book the indenting. So you will see your subsection, right? Then you will see your subheading. And then your category will start moving over. It will be indented. You see how this is way over here and this is indented. You can't tell it because it's a step-by-step book. But, you know, this is a good example right here. So your section is here. Your subsection is here. You see section, surgery. Subsection, digestive system. I'll follow it in your book because I know you can't see that screen up there. Where is it? You can't really see the screen up here, so I want you guys to follow it in your book, but this is where I am. I'm going to snatch this off only because I know you've got your book. Okay, I know you got your book. If you don't, let me know. I'm going to put it back up there. Okay, so at the top, so the page that I'm on 360 if you guys have your ebook. If not, if you have the other Kindle book, just get to this page. Okay, I'm in the guidelines. Okay. So section, surgery. Digestive system is your subsection. Your abdomen is your subheading. Okay, category is repair. Subcategory is hemography. Notes. They all have the same outlook. Okay? So all you're going to do is just take heed to it and read everything that you see there. What time is it? Okay, it's 6:53. Unlisted procedure, that's where you're going to stop at. Okay? I got to put it up because I can't show you what I'm talking about. So, unlisted procedure, that's where you're going to stop. We're stopping right here only because I don't want you to get confused. I want you to stick to your guidelines. I want you to stick to your guidelines. Your unlisted procedure is going to be in the back of each chapter. So in the back of each section, that's where your unlisted procedure is going to be. But here, I want you to kind of stick to the program, okay? So you could do this quick 13 to 2. If you actually finish, you can go ahead and do some of the coding here, but stop right here, okay? Stop right here. Where are they? Right here. And this is pretty short. I mean, you guys can do that for homework, but what I want you to do is focus on the surgical guideline portion before you start trying to do the codes, okay? So we've already went through how you guys are going to do the coding. This is pretty much you going through your book. So you see this is musculoskeletal system in general right here. You should be able to get that code because musculoskeletal system is in there. Okay, it's in there. Okay. When we get to special reports, I think special reports is okay. You can go ahead and do that one. Separate procedure. When I come back, I'm starting from right here, unlisted procedure. Okay, if you want to read that, you can, but that's where I'm going to start at. Right now, I want you to kind of get used to the sections. Get used to the subsections. Okay, this is my go-to right here. Okay, if you have, can you guys see this? Yes, if you have your own book, that's where I want you to be. If you have your own book, I want you to make notes. If you have index cards, you see how the order of that is? I want you to take your index cards and put that order on an index card. So the order that I'm talking about, section, write it on an index card. Section, surgery. Subsection, digestive system. Okay? Subheading, category, and subcategory. Okay, that's what don't worry about the notes. That's notes down there. You can read them. Okay, but they're just pretty much telling you what's going on with that code. Okay, the order of this is important. Okay, because you might have a question on your chest to say what comes after subheading. Multiple choice, category. Okay, so I'm gonna shut that down. So that's the reason why I want you to use your index cards and put that on there. So I can't believe it's 6 o'clock, it's 7 o'clock already. Well, because I got another class that I got to do after this, but continue to read the surgical section, okay? I want you to make sure that you also have read the ICD-10 guidelines. We've already finished with that class, but some of you that have started in, you can go ahead and start with the beginning of this coding class. Go to there's a coding playlist that's specifically separate. I didn't put them all together. I put them separate. Okay. But there is a file where everything is in there. It says free coding class. All the classes are in there. So I also put them in there as well. But I have one that I separated so you guys can take a look at them. Okay. What else? So if you want to get a hard copy book, you can. If you want to get a hard copy book, it will make it easier for you to do highlighting. I use the ebooks for class purposes, but I would prefer that you get a hard copy book. Okay. The ebooks that I'm giving you they're temporary. I don't want you to get used to those too much because that's not what you're going to use on your exam. I gave you those books so you could start the class right away. So that's why you guys have those books, so you can start the class right away. Okay. So again, if you guys have any questions for me, I can answer any questions for you in DM or DB discussion board if you want to. Okay. Do not forget to do figure 13 to 5. Okay, I want you to do that. I also want you, only because we did this, we looked at one symbol. One of them has deleted code. There was another one in here. Deleted code and revised text symbol. If you have a hard copy book, look at the bottom of that book. And let me see if it's in here. Look at the bottom of that book. See, this one, I don't see them in here. Yeah, they're not in this book, or maybe I just don't see them. You know what? I don't see the symbols at the bottom of this book. Okay, it's in the hard copy book. So if you guys can get the hard copy book, that's fine. Even if you get a 2024, that's as far back as I want y'all to go. 2024. I don't want you to go too far back. So in the surgical section that we just went over, okay, just make sure you get those guidelines down. And the order. Okay, I'm gonna drop it up there one more time. I need to make sure that you guys are clear on the order of your book, your CPT book. So right here, make sure you put this on an index card, because this was a question. See, it says section, subsection, subheading, category, and subcategory. Okay, put it on an index card, because that looks like something that's going to be on the test. Now, those of you who have not went on the website for AAPC, I'm going to put aapc.com up here so that you could take a look at it and you can see actually what's going to be on the exam. It'll say medical terminology, 3 questions. It will say respiratory, 4 questions. You don't know if it's going to be an open question or a closed question, but we do know that you need to practice your coding and reading. Reading takes perfect. I don't know how I said that, but y'all know what I mean. Read. The reading will help you to retain, okay? And especially being that we just started the surgical section, we're in the guidelines part. And as you guys can see, there's coding down here. Okay, there's coding right here. Let me put that up. I don't know why that's there. Hold on. What happened to my screen? Okay, there we go. There's coding here. Okay. You're going to have to do that coding, but we're going to do it together. Okay. Just be precarious. Look at the book. Okay. It's already 7. Okay, I'm leaving. I'm going to be back Monday morning. This is surgical section, and we're going to take it slow. Okay. I'll see you guys again. We're going to take it slow. Bye. Don't forget your books. No, I ain't leave yet. Get the ebooks, but I want you to have the hard copy. Okay.